Welcome everyone to today's webinar. I am Emma Goodman with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. We are pleased to have Scott Becker, publisher of Becker's Healthcare, here to moderate today's question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation recording to the email you used to register. At this time, I want to thank today's webinar sponsor, Teladoc, and introduce our presenter. Dr. Alan Roga serves as president of the provider market for Teladoc. He has full P&L responsibility for the strategic direction and management of Teladoc services offered to hospitals, health systems, retail clinics, and physician groups. Dr. Roga was founder and chief executive officer of Stat Doctors, a national telehealth company serving individual member patients through agreements with organizations including hospitals and health systems. He led Stat Doctors from its inception in 2009 to its acquisition by Teladoc in 2015. An emergency medicine physician, Dr. Roga is a fellow of the American College of Emergency Medicine and a diplomat of the American Board of Emergency Medicine. It's now my pleasure to turn the floor over to Dr. Roga to begin today's presentation.
Well, thank you very much, Emma, and good morning and good afternoon, everybody, depending on your time zone. Very excited to present to you today the survey that we completed in partnership with Becker's on the Hospital Executive Survey for Telehealth, which really represents the first time to our knowledge that there has been a benchmark survey regarding telehealth status and thinking really from today's hospital executives. So I know we presented it previously at the Becker's conference. We've had great feedback on it. And I think it should be very informative and helpful for everybody. So with that, I will go ahead and begin. Let me just overview what we're going to discuss today in today's agenda. We have an hour. We'll certainly leave time for question and answers towards the end, which will be moderated by Scott Becker. We're pleased to have him today. Give you a little bit about Teladoc to start. Then we'll talk really about the meat of today, which is the construct of the survey, the overview, the findings, and weave in really what we found as key success factors. Before we begin, as Emma provided my bio, which is much appreciated, my capacity, I lead the provider market for Teladoc. So I lead a dedicated business unit that is focused solely on the provider market. It's been my privilege to be in telehealth now for about 8 years and seeing this market evolve. So as Scott and I were talking before the webinar began, I'm just very passionate about the space. And while I no longer see patients, I think this is a great way to provide patient care and be really impactful and meaningful in the healthcare system. A little bit about Telodoc before we get into the survey and the findings, again, to give everybody background on the company. So Telodoc is the first and largest of the modern-day telehealth companies. We've been operational since 2005. Went public on the New York Stock Exchange in July of 2015 and are the only publicly traded telehealth company. Well, what we do is connect patients to providers through mobile, internet, or phone, through both on-demand and scheduled visits. When we are connecting to our network of providers, we provide general medical care, behavioral health, dermatology, smoking cessation, and sexual health as product features connecting to our network of almost 3,100 providers. But oftentimes, and I know there's a lot of provider organizations on the line, we connect to your providers. And also our network can be a failover system to the degree you need us. We work in 3 main markets. We work with employers, insurance carriers, and hospital systems. And we'll talk about market evolution and how that's really transpired. All totaled, we have over 7,500 clients. And the slide needs to be updated based on our recent earnings call, but now we're over 20 million members. 240 of the Fortune 1000, 30 plus national payers, and over 140 hospital and health system clients, which is one of the fastest growing segments of the company. When we are providing the care, outstanding care. 95% patient satisfaction, 10-minute meeting response time, and we're seeing at our max about 5,000 patients a day. This year, as a frame of reference, we anticipate we will see 1.4 to about 1.45 million telehealth encounters, and that's when our providers are providing the care. That represents about 75% of the acute general medical care market, and those proportions have been consistent over the last several years, Teladoc reflected to the other competitors in the space. Now, when we work with an employer or an insurance carrier, it is a very transactional value proposition at some level. Can we save the health plan money? Can we keep the employee out of the ER or urgent care center and keep them at work and increase their productivity? And we provide great results there for our employer clients and our payer clients. When we work in the provider market, this is very much a strategic alignment of a telehealth delivery system to the organizational goals. In fact, it represents the #1 opportunity I see in working with our hospital clients. So we approach this really to build provider organizations, business, and brand. And we believe there are sort of 3 core pillars that we have our offering designed around. First, there's a dedicated team, which of course we mentioned I lead. But we are the only major telehealth company that has a dedicated division that's focused solely on the provider market, which provides our opportunity to yield subject matter expertise, because myself and the rest of our team all day long talk to different provider organizations, learn about their needs, but also I think we're a little more nimble and better able to meet our clients' needs by the fact that we've got dedicated technology, sales, account management, marketing resources to help drive the needs of the program. At the core of our offering is a licensable software. So it's a SaaS-based model. It's not only a cloud-based solution, but it's cloud architected. So every client essentially gets their own instance of software to build their business and brand. And then finally, there's operational support, which is often, again, underappreciated in a telehealth delivery model, from our end-to-end operations center in Dallas, Texas, that houses folks 24/7 to make sure that patients have a great experience, to our provider network that can supplement the organizations and the hospitals providers need to the degree you need. And then finally, around engagement, marketing, commercialization, we have essentially most, if not all, of the resources that a provider organization will be looking for to drive adoption, which we're really good at, from snail mail to digital marketing to collaterals to social media, all again to help drive utilization of the program. And we're very proud, by the way, at the bottom, not to be neglected, that with the software, we actually were awarded the exclusive endorsement of the American Hospital Association specific for technology. And that was a competitive assessment of what was in the market, and we were awarded that specifically for software because we know that's key to a lot of the offerings that provider organizations are looking for. As we mentioned, sort of client profiles, but I think it's really important just to touch base on, again, that the fact with a dedicated team, we're able to better meet our clients' needs. So as an example, employers and health plans, they're often looking for member attribution, eligibility file transfer, and those features are important to hospital systems, but hospital systems often care a lot about video, making sure that the patient has the ability and the provider has the ability to see the patient, and EMR integration, and things that, again, are relevant more to this space specifically. All right, so enough about Teladoc, and now really segueing into the survey. So the goal of this survey, and I'm going to apologize in advance a little bit to the audience, but this is a content-heavy presentation, right? We're presenting a survey, so I will be reading at some point up the slides, but certainly be infusing what we have seen as best practices in our experience. But if you look at consumer telehealth specifically, I think that it is very hard for provider organizations to start making decisions around consumer telehealth. Hospitals and provider organizations are used to telehealth as far as inside of the facility, telepsychiatry, polycoms, point-to-point, but this is really consumer-facing telehealth. And how do you go out to the market and meet the consumer on their terms? how they want to meet. Because until they select you to engage in patient care, they're a consumer. To me as a doctor, once I'm engaged with them, they're a patient. But until then, they have choices. And consumers now are looking for access points. But it's very difficult, I think, for provider organizations to learn about consumer telehealth because you have to go to the market. There are vendors like us. People are concerned about vendor bias. And it's hard. So what we decided to do is actually provide, again, to our knowledge, the first ever benchmark survey of provider organizations so that you can read this and see what your fellow colleagues are looking for. So our goal, what we set out to do, was to develop a benchmark tool for leaders they can reference as they're beginning to either implement or expand their programs or choose their programs. Why we embarked on this? A lot of the reasons I described before. The markets are evolving. And having been in this space for about 8 years, I can tell you that the market for consumer telehealth firmly started in the employer space. Employers were looking for cost-effective measures to keep their employees out of the ER or urgent care center. Then it evolved to the payers because we were having successful outcomes. And now it is squarely rooted now in the provider market. In fact, as I indicated earlier, is one of the fastest growing segments inside of Teladoc. 5 years ago, really, hospitals weren't ready to have the conversation around consumer telehealth. But now that financial risk is being shifted and there's new payment models and we're embracing that there are delivery systems that can expand their access to care, that's where you're seeing all this provider market. But again, consumer telehealth is a little bit different. We find hospitals making big investments, but there's lots of starts and stops and uncertainty. So this is our gift to you, which is a survey with benchmarks. So our methodology was to partner with Becker's to get third-party collection. As you see, we focused this being on primarily an executive-level survey. Our goal was to do this rapidly, 150 response within 60 days, and essentially 3 tracks. Those who had telehealth, those who are getting ready to do telehealth in the next 24 months, and those who really wanted no part of telehealth in the next 24 months. Here's a sense for our respondent profile. So as we were able to get 179 survey respondents, again, the majority were director level and above, and predominantly at hospitals that were greater than 100 beds, which is very typical of what we're seeing. Not that there's not a valid value proposition for less than 100 bed systems, and we'll talk about that, but a lot of the interest is in the larger hospitals and IDNs. You can see on the right-hand side, again, the titles, predominantly executive and director manager, pretty much a split between for-profit and non-profit, and then you can see the different system types. We had, interesting enough, a high level of respondents from the Midwest. I will tell you anecdotally, we are seeing a great degree of activity in the East and the Midwest. The West actually has picked up quite a bit, so I was a little surprised, only about 15% respondents. That might have been some of our study design, but that's a flavor for the profile of who responded to us. So now, what are the key findings? And this is going to frame a lot of our talking points today and a lot of our discussion. So 76% of hospitals that responded to us either have or will be implementing telehealth by December of 2018. So over again, the next 24 months of the end of the study design. And 69% of those organizations are expanding, which we found actually interesting and aligned with what we found. As far as the hospitals that are getting ready to implement, we've seen a 10-fold increase in proposals, requests for information, formal RPs, et cetera. So again, in alignment for what we're seeing is a lot of market activity. 83% of those systems rated as a high priority. Main goals are around access, care coordination, and managing risk, which this really aligns with the value drivers of what we see. Excuse me, the key drivers for implementing are at-risk and competitive market, again, very much in line with what we see. And this was a little surprising to us that most programs are starting with primary care focus but using a vendor's network. And I'll share some insights around that. Reimbursement is viewed as a challenge, and aligning organizational goals is very much key. And then, of course, when looking at a partner, satisfaction, software, and support capabilities are key. So if you are answering emails or tune out through any of the webinar, I encourage you to focus on this page because here are your key takeaways. Not that anybody would do that. So on to some of the specific summary findings now in a little bit more detail and granularity. And we're going to go from high level strategic to then go towards tactical, and then finally what are systems looking for as they're looking to implement telehealth programs. So first thing again we found is that the majority of systems, 76%, are implementing or will be by 2018, and going left to right in the boxes. So how long have they been in place? 43%, 1 to 3 years, which was, again, the majority of the response we saw here. But overall, about 80% have had these programs in place for less than 3 years. Again, not surprising based by what we talked about in regards to market evolution and where it's gone from employer to payer to now hospital market. Who's in charge of the program in the middle bucket? 39% have a director level assigned to a C-suite. And overall, if you look at the summary, 81% have a dedicated person in charge of their program. I think that's great. What we see now emerging is a formal director of telehealth as a best practice hire. So I will tell you that most systems that we are working with either have hired a director of telehealth or will be hiring a director of telehealth with their programs, especially as we get to value drivers and use cases. But I had not seen that role. I saw that role in the minority of systems, I would say 2 years ago. So I think that's a really interesting market evolution that we're seeing. And finally, ranking it as a priority. So the takeaway is 83% rank it as a high priority, which we defined as 3 or above. So the summary of this slide at the end of the day is your typical system has just launched and has it in place in the last 3 years. They're hiring a director and they're declaring it a priority. And I would tell you that's very much what we see in the market as well. So how are organizations now utilizing telehealth? And they're really capitalizing on what we spoke about earlier, which is this is consumer facing. This is meeting the consumer to where they want to be as opposed to inside of the facility. And the main goals are increasing access, care coordination, and managing risk populations. This is, again, aligns with what we see in practice and what we feel are the value drivers. So I would say overall there are 3 main buckets of value creation. They are around finance, access to care, and then growth strategies. And each of their use cases need to align with the organization. So on the finance side, wherever the organizations are taking risk, that's where there's a valuable use case. And there's numerous demonstrable case studies that we can provide that show a return on investment for that. Access to care obviously is quite big. And then growth strategies around new patient acquisition and retention of existing patients. And we'll talk about some of that. But if you look at the survey results, again, number 1 was improving care by making it convenient, creating efficiency models, and then looking at discharge instructions and readmission strategies. I would say that what we see in practice, and I would say I think these are great goals, but potentially could be somewhat aspirational, because when we sort of push comes to shove and we start with use cases, the number 1 use case is typically where there's a financial risk for the patient, and then access to care obviously feeds into that. So this is what we found. I'll tell you in practice, a lot of it is focused around how we better in managing the cost component of that patient, and then of course leveraging access to that. Key drivers. So at-risk contracts and competitive market, again, somewhat what we talked about, 55% of the organizations that have telehealth have an at-risk contract. And then if you look at the competitive landscape, again, 54% are competing. We understand market share is critical for most systems. 30% are competing with the urgent care centers. And then the takeaway, what we found also was 37% of the organizations stated that managing the at-risk contracts were key to their organizational strategy. I would say that most provider organizations come to us for one of 3 things. It is either managing the risk population or it is grabbing market share. So this aligns with that. And they either want to retain market share or grab new market share. The third one is often, at time, there is I would say a clinical project that an organization is looking for. A cardiologist and neurologist wants to use telehealth for patient management. I think that's the minority on it. By the way, 5 of the top 6 use cases we found in the survey underneath this showed risk contracts were there for systems who were getting ready to start telehealth. So those who have telehealth, we found actually 69% of those are expanding. On the left side, most common status, again, 69% is expanding, 13% are remaining in pilot phase. And if you look at where they're headed, so most of the folks are serving the general public. 68% are going to the public at large, 54% are with their own employees, and then looking at other populations. And then where are they expanding into? It's that entire risk bucket around ACOs, and managed Medicaid came up quite a bit. I think it's really important to call a few things out on this slide. So I do think starting with employees is a very nice use case. It creates a lot of value for the provider organization, saves the plan a lot of money just as a large employer. And often, by the way, the return on investment for the employee benefits program can pay for any of the platform fees that most of the vendors charge if you drive successful adoption. But I think what's also reflected in this slide is a lot of people started with the general public, and we'll talk about it when we talk a little bit about consumer programs. But I would advise everybody on the line to be very thoughtful about the populations that they're approaching when you mention the general public. So the general public can be approached, really in our estimation, through 3 main segments: going to local employers where you may have a relationship with, populations that you currently serve, and then going into new markets. What we see is that a lot of people looked at telehealth early on, and I think some of this was vendor-driven, not necessarily by Teladoc, but out in the market of, hey, this is a new delivery system that you can go out and get a lot of new patients. I think a lot of systems have found that grabbing new patients just going out to people who don't know your system is a new venture, and marketing to them requires expertise as opposed to populations that you have already an existing relationship. And I think that people now are reevaluating really what are the capabilities of their vendor partners based on their experience, because they're realizing that, hey, at-risk populations and access to care and these other issues really do provide an opportunity for our organizations, not just necessarily digital marketing in a competitor's marketplace. So how are people now starting? And what we found is hospitals overall are really now learning how to engage patients. They're just starting to learn how to engage patients and their physicians in their program. So if you look at the left-hand slide, and I think, I hope I convey this slide adequately, but I think there's a lot of really valuable information here for the folks on the line. So how do you start? Most people on the left-hand side are actually starting with primary care and using a vendor's network. So most common specialties: general medical care, primary care, and typically acute care that would go to an urgent care type center. And then behavioral health, psychiatry, talk therapy, next in line, followed by readmission. This was somewhat surprising to us, though, on the staffing model. So 42% using their own providers, 30% using the telehealth vendor network, and 16% just using the vendor network. I would say that 99% of our clients are using our network in some capacity. So I would say that was a little bit of a surprising finding for us. But kudos to everybody who's doing their own providers. I think there is a skill in education and getting your providers aligned that's really important. I would also add what we're seeing now regarding additional use cases and additional providers. So most systems start with general medical care. Usually it's with a vendor's network. And then now we're evolving in their specialists and subspecialists for post-surgical care, where they're in a payment bundle, where someone just had their hip and knee done, and why are we dragging them all over town for a wound check when we can easily do that virtually because it's already in a capitated payment program at some level. General medical education, so graduate medical training, is an interesting use case that we're starting to see more and more of now. So just a little bit of market insight. So general medical care with or without a vendor's network, but predominantly with a vendor's network, that's pretty typical. And then on the right-hand side, systems are really just starting to learn how to drive adoption. So looking at annualized visits, 75% of those surveyed did less than 5,000 visits. And their marketing budgets, 69% are modest, under $250,000. Engaging consumers in consumer-facing telehealth is a skill set. It does require experience in intellectual property. As a frame of reference, as I indicated early on, Teladoc will do 1.4 to 1.45 million acute general medical visits in 2017. We're good at it. We've learned at it over the last 12 years of experience. What are the best practices? What are messages to specific segments? How do we really drive adoption through surround sound? And I think that I would encourage organizations to really leverage their vendors' capabilities, because that intellectual property is really key, and it's expensive learning to do it on your own. And I think systems are learning that now. So, getting 5,000 visits to, do digital marketing in a competitor's market space, not always very effective. Some spots in the United States, it's very effective. Others, it's not. Driving utilization through populations that know you, very, very effective. And that's really what we pride ourselves on. When systems responded, patient and physician satisfaction were felt to be the most important elements for success. So look at primary care or acute general medical care with or without the vendor, although I would encourage you to look at a vendor's model. And then I would encourage you to look at your vendor's capabilities in driving utilization, learn from them, make sure your patients and doctors are satisfied. That's your package on how do you start a successful telehealth program. So when we asked about the top challenges, we came back with a series of responses. If you look at the left-hand side, really reimbursement at 34% was felt to be top, and then IT integration, closely followed by IT integration. Not surprises with either of those. But we thought this would be a good opportunity to actually talk a little bit and maybe educate the market about this market in the industry. So 34% site reimbursement, which is accurate, right? I mean, this is a different type program than somebody walking in off the street and putting down their insurance card from any of the various large insurance carriers. However, Telodoc will do nearly $180 million in revenue this year. And that goes through looking at who holds the financial risk, where is the plan sponsor. So that can be through ASO groups, like employer groups, that can be through payers. So I'd encourage everybody to rethink how they're looking at payment more as who holds the financial exposure for the patient, and less so around the traditional commercial reimbursement models. Now, along those lines, there are now 32 states with parity laws. That is actively increasing every year. We are seeing systems entering into relationships with their existing payers to get reimbursed the same as an in-person visit, looking at GT modifiers, and getting their billing processes smoothed out. I would say that from a market timing standpoint, what we have seen is the payers are ready, the parity law is in place. It's more of a timing discussion as to working out the mechanics of how they smoothly do claim submission and reimbursement, as opposed to changing the reimbursement models. So that was a mouthful around reimbursement, but wanted to give you a little bit of flavor around that. As far as EHR integration, clearly most of the organizations on the line have made major investments into their EHR companies, often to the tunes of tens of hundreds of millions of dollars. So we understand as an industry that you want to get the data back in. That data is getting back in through CCD feeds, HL7s, integrating with HIEs. I think most of the few vendors in the space that have operational scale have recognized that this is important to do and work with the major EHR companies. 14% noting around other priorities. I think it is a challenge, right? Why does this rise to the top 2 or 3 in priorities for an organization? And I think it's less of a recognition that's a priority and more it's a recognition of we're not sure how to get started. So, as an example, we've developed a readiness assessment tool where we actually have a strategic planning process where we help our clients think through their telehealth strategies and align them to their organizational goals. And our clients have found that very helpful because then they can just assess vendor choices based on capabilities and not trying to figure out strategy at the same time. I think that if you're not doing telehealth, in the next few years, you will be behind the curve. So while some folks may say there's other priorities, again, 76% of our survey respondents are doing it. And I think one of the challenges with the space is actually using the word telehealth. This will be just the way you receive health. This is healthcare. It's not the operating room or the urgent care center. This is another vehicle, or the ER. There's another entry point for your patients. Going on the right side of the slide around desired features, if you think reimbursement was the priority, then of course number one is around claim submission, then looking at referrals and wearables. I think what we have seen now, and incorporating some of the features around the other slides around how people are thinking about their programs. So I think a lot of folks looked at, I just need a video solution to, for lack of a better word, FaceTime, Skype, or whatever modality you want to use with a patient. But I think now systems are realizing that these are delivery systems. And in those delivery systems, you need to have sophisticated workflows and configurability that allows for member attribution and exchanging real-time exchange and understanding payment structures, as well as video and documentation systems and clinical features and electronic prescriptions. So what we have seen actually is a lot of hospitals actually went to market with just some sort of solution, whether it was internally generated with the video software or with a different vendor, and now are evolving really to recognizing that there are best practices here, there's best practice in the software, and these things that are perceived barriers around reimbursement and integration and software actually are present in some of the more sophisticated solutions out there. So when we ask the question around what's success in implementing a program, 75% said it's critical to align to organizational goals. And we took a little bit of poetic license with this because if you look at the left-hand side, actually 78% said gaining physician buy-in was top above this one by 3%. We also saw engaged leadership early and telehealth operational support. But I would share with the folks on the webinar that the number one opportunity that we see and the number one challenge we see at the same time is that organizations that align their telehealth program to their organizational goals are far more successful in their programs than the organizations that look at this as a piece of software and don't really have a well thought out business case or strategy around it. So one of my key takeaways from everybody would be make sure that you're aligning this delivery system to your organizational goals. And if you do that, you're very successful. The other thing that I thought was pretty key is making sure that there's operational support. So I think most organizations underestimate operational support by at least a factor of 10. No matter what you do and how sophisticated you design your system, a patient is going to have an encounter at 8 o'clock. They're going to go to Walgreens or CVS at 9 o'clock, and the pharmacy is closed. How do you reroute that prescription? What do you do when a patient can't log into the system or a provider is having technical difficulties? So all of these things are really key. The other thing around important elements of success, so patient satisfaction, again, physician buy-in and patient satisfaction, utilization, and ROI, interestingly enough, is a distant fourth on this list, although important. As you go to payer or employer clients, I will tell you ROI would rise probably to the number one on this list. So they want to see return on investment, typically at least threefold for any investment that they're making in a telehealth program. But clearly, make sure your doctors are aligned, make sure your physicians are aligned, and your patients are satisfied. Adding a little bit more color back for a second on physician buy-in. So it is very typical. I would say anecdotally about a third of our organizations at some level, there is a question that arises from the providers. Ultimately, is this competitive? Are you taking patients away from us? I think that first off, physicians, and those physicians, by the way, typically become champions of the program because when they understand the delivery system, they embrace it. So typically physicians want to make sure that there's quality care. I would say at Teladoc, we have enough experience now that we can show great outcomes. I mean, we've done well over 2 million encounters, 2 million visits, no bad outcomes, no malpractice suits, very happy patients, by the way, 96% physician satisfiers. Are there clinical guidelines and protocol in place? Is there quality oversight? Is there a QA committee? Once providers see that there's quality, they tend to be more comfortable. The other is, of course, you don't have to use a vendor's network. And the third is this actually can be a tool that they use for their patients and also to drive volume into their clinic. So that combination typically gets physician buy-in. One other thing I would add that I don't see on the list for keys to implementing successful consumer telehealth programs, but I often find that legal is left out of the mix until the end. And I would say that we find that a challenge, because I would say get legal involved early on. This is a different sort of delivery model, and you want to make sure they're comfortable. So not that they're roadblocks, nor do I think they're major roadblocks, but areas where I've seen provider organizations sort of bump up against challenges as they're getting ready to go live. So who is not doing telehealth, right? So when we ask this question, who's not interested in doing telehealth over the next 24 months, it was somewhat the exact opposite of those who are doing telehealth, right? They don't have at-risk contracts, and they're not really in a competitive market. So 67% of those said, we don't have an at-risk contract, and we have no plans to get into this world. And the other side of it was, not only am I not in a competitive market, but reimbursement is an issue. I'm not sure where to start. I think there's other capabilities. When we delved down into the data a little bit more, what we found was a lot of these were critical access hospitals. They were smaller systems. I think this represents a tremendous opportunity for a critical access hospital. I think the challenge is really the one mentioned on the barriers, which is that they're just not exactly sure where to start. And that's why I think I'm a big believer, and we're a big believer at Telodoc, of systems creating a multi-year roadmap. So making sure that your organizational goals are aligned with your value drivers around finance, care coordination or access to care, and then market share, and then figuring out what are the use cases so that they create the most value, and really driving value around complexity, urgency, and need are the biggest keys that we find. And then once systems have that, there's actually great value proposition for the smaller systems. And now, when looking for a partner, what were people looking for? So what we found was satisfaction software and support capabilities were the ones that were considered key to finding a telehealth partner. So when we looked at the important factors, so what were people looking for? And interestingly here, this was consistent across all three groups. So whether they had telehealth, where they were just getting ready to implement telehealth, or where they didn't want any part of telehealth, what did they think were the most important things? 68% were about satisfaction, right? Are all of your stakeholders satisfied? Your patient, your physicians, your providers, and your administrators. 54% is about the software. Is there video? Does the video work? Does it work at low bandwidth? What are the downtimes? How does it integrate with electronic records? What are administrative tools so I'm not always at the mercy of the vendor? And then finally, vendor support, right? What are the support capabilities of the vendor that we can leverage to drive our program? Now, we were happy that we found these findings, again, blinded to it, because I think it affirmed a lot of our direction and around capabilities, specifically at Teladoc. So on the satisfaction side, I think this is key. Make sure that your patients are satisfied. Again, are there survey tools? Are there data that you can collect? What are the guidelines that the provider uses? Are there QA protocols? Again, are there outside entities as well that have affirmed some of the value? At Teladoc, we've been NCQA certified 3 times with a 100% score for our credentialing. We're very proud, actually, of the quality components. In fact, in many ways, I would tell you, I think we're the quality leader in the space. But also, you have administrators that want to be satisfied as well. Do we have rights to the data? Can that data be exported into our population management software? What kind of reporting structure and business intelligence is there in the platform? What are the tools that we can become self-sufficient? Very, very key. Then on software, and we know video matters to this market, right? If you look at the employer and payer space, a lot of those interactions for general medical care are around telephonic interactions, and they're really access to care, and they often have video or photos as support. In the provider space, you can tell their clients that have 100% video. That's the only way they allow access to care. So we understand video has to be solvent. There can't be any downtimes, or at least minimal ones. Need to function at low bandwidth, be easily accepted. EHR integration, Epic, Cerner, Meditech, Allscripts, Athena, all the different vendors. How do you do it? And then, of course, can we become self-sufficient, load our own providers, have tools and reporting capabilities? And then lastly, around vendor support, I find, again, number one, look at aligning your programs to your organizational goals. And then the second biggest opportunity, do not underestimate the needs for operational support. So, at Teladoc, we've actually built a facility, a 75,000 square foot facility in Dallas, Texas, that houses people 24/7 to make sure that member attribution can occur and eligibility files are there, and claims and submission and call center agents and troubleshooting and technical support. And when folks walk our operations center, I think it's very enlightening for them to see how do you do telehealth at scale, because either you're going to need to build some of those capabilities or leverage your vendors. What are the tools to train physicians, train providers, drive marketing and utilization? What are those best practices? And all those things I think are important to think through as we're looking and as you're looking at designing and implementing your telehealth programs. So thank you, everybody. With that, I'm going to turn this over to Scott to help moderate our questions, and we'll take questions from the audience, and we'll be responding.
Great. Dr. Roga, thank you so much. It's amazing for us to see the sort of tremendous growth in telehealth over the last 5 years. When you really started getting into this 8, 9 years ago, it was really a nascent thing. In just the last several years has really taken off. A handful of questions to start with. Were there any findings in your survey that you weren't expecting? What surprised you in your survey?
I think what surprised us the most, there were pleasant surprises, and then there were scratch your head moments. Pleasant surprises, certainly for us, were around looking for what the market and the clients were looking for around, again, satisfaction, operational support, EHR integration. Some of the scratch your head ones. So I was very surprised to see 42% of systems actually using their providers exclusively on the platform. And not that that's a challenge at all, Scott, or to the audience. That certainly that's configuration for most of the, I think, more evolved telehealth vendors, if you will. But in practice, we have not seen that. So in practice, I would, again, state 99% of our clients use our providers in some capabilities for specific use cases. So, as a vendor, our providers will do general medical care primarily, although also behavioral health and dermatology and some of these other product suites that we have. But for the general medical part, which really I'm using that as a bucket to relate to virtual urgent care, if you will. So the lumps and bumps with the urgent care, pink eye, bronchitis, urinary tract infection, minor aches and sprains, rashes, the acute episodic care. Almost every system we have wants to allow our providers to do that for them and weave in some of their providers. It could be their doctors first in line, fail over to our network after 10 minutes, nights, weekends, and holidays when their doctors aren't available. So I'm not sure if that answer was really more around specialty and subspecialty care, which while we do provide some specialty and subspecialty care, the patient who just had general surgery or orthopedic care, urology, one of those really rapid growing use cases that we're seeing, clearly that's where the hospital system is utilizing their own providers, not ours.
And so I'd love to, let me ask you some other questions. That's a fascinating issue as to whether it's a political issue, a territorial issue, what sort of drives that. Let me move to a different issue. In terms of a hospital starting to use telehealth, what are the first use cases that hospitals usually start to work with? Where does somebody start a telehealth program? What's the most common and why?
Yeah, no, it's a great question. So we always look at it as important for a system to have a multi-year strategy. And if you look at those big value drivers around finance, access, and again, market share, I'm a big believer in crawl, walk, run, get some wins under your belt, and then expand and be aspirational. Very typical for a system. I would say a standard hospital, year one in the finance category, they'll start with an at-risk population, usually their own employees. It's a great place to start. It's sort of a test lab where you start to learn about the program. It creates great value, and often, again, can justify cost for the platform just in that one use case. And then year two, they might expand into their ACOs. They might own an insurance carrier. Then year three, go into more at-risk populations around readmission bundles and different payment methodologies. On the access to care, usually year one, they start with a primary care provider. So load a bunch of the primary care providers, have them doing virtual care for their own patients. Year two, bring in the specialists and subspecialists. And then year three, again, expand to non-physician providers often. And then on growth strategies, year one, often we'll go for a retail program. And I think it's important for systems to test the water on a retail program, whether it's to local employers, whether it's to patients that they currently serve, or going direct to consumer through a true retail strategy. Year two, they'll often try to drive that volume into their clinics. And then year three, they try to expand market share. So not only in their local market, but regionally, multi-state, and occasional nationally. That's a pretty typical multi-year roadmap for, I'd say, about 70% of systems that we meet. We just completed one, though, with a very progressive system where when we finished our readiness assessment tool, it was very clear that the number one driver was acquiring new patients, but the number two driver was chronic care, condition management. So a lot of this is look at your organization, have what is already identified in your organizational strategy, and then make sure this program aligns to it.
Gotcha. So is there any part of the original use case, deciding on first use cases, that is really specialty specific, or is it more around goal specific as part of a longer term plan?
I think it's a little bit of both. So, when we meet with a provider organization, really our first questions are, tell me about your system. Are you taking financial risk? Are you in a competitive market? What's your physician alignment strategy? Tell me about your EHR company. What are the three things you have to get done in the next 3 years? And then we can help you come up with your strategy. So, as an example, one of our clients at Jefferson Health, one of their biggest use cases is really around surgical and subsurgical care. And looking at how they extend reach of their patients. And that's really big for them, and really big at looking at consumer engagement strategies and, going to other systems. It's all about financial risk. We have one client, they have 300,000 lives, they own an insurance carrier. For them, it's about how can they manage those. So it really is, at some level, answering a question with a question.
Got it. So it's very much dependent upon what they're trying to accomplish versus you guys having just, this is the solution, this is how we do this or that. It's really understanding what they're looking for and what they're trying to accomplish. And it differs. If they're completely at financial risk for a decent sized patient population, it might be one goal. If they're not, it might be a very different goal, which goes around patient acquisition.
Absolutely. There's one system we've just partnered with. They're in a fiercely competitive market. Three other major systems. They're all across the street from each other. Everyone's got a telehealth program, and they've got to stay competitive to keep their market share and to sort of meet the needs of what's being out there. So for them, it's all about how do we do a consumer program. For another recent client, they all have risk populations. So it is the best and most successful programs ask themselves, what do we need to accomplish as a system, and how does telehealth align with it, as opposed to let me go look for a piece of software because it's cool.
Got it. Let me ask you another question. The type of utilization that you have with clients, how deeply do they use you? What kind of utilization? How do you look at that question?
Yeah, and it's a great question, and something that, and quite frankly, we pride ourselves on at Teladoc. So we always look at utilization as who is the population that we're serving. So if we're serving, as an example, an employer, and even a hospital as employer, if they have 2,000, 5,000, 10,000 employees, how much of that population are we capturing to drive a visit? So we might have 10,000 names in the file that's loaded on the platform, but if nobody uses it, then it's somewhat a gym membership, and it didn't really create a value. Although no disrespect to anybody who goes to a gym.
We all have that, yes.
But so I can show you clients that, and we've got one client that has 105% utilization, meaning their entire population is about 3,000 employees, and they will have over 3,000 visits this year. They're driving tremendous adoption. And the keys to utilization on an employer side is often around the price of the copay, but more importantly, having a very sound communication strategy and how we're messaging that. If you have those elements in place, the programs work very, very well. So engagement and adoption on utilization is often around defined population. If you go to the other extreme, so if you go to how do we define utilization or visits to unknown populations, so we've had new clients come to us that have been out in the market with other entities and said, I only had 3,000 visits with my consumer program, and we looked at it and we said, well, because you're trying to message 500,000 people in your community with a $200,000 budget that you've never met before. Driving that adoption requires a lot of sophistication, and I think also setting your expectations around the fact that those are going to be trickier to engage. You can be very successful there. It does require skill and expertise, but you've got to understand the market. Are you going after millennials? Are you going after Gen Xers? Are you going after baby boomers? Are you going after the busy couple that needs extra time with their kids because they're running all over the place? And how you target your marketing and messaging, that's what ultimately leads to a successful utilization in that program.
Is there a certain, minimum amount of adoption or engagement where this starts to make sense? And then, Dr. Roga, I don't want to, number of questions about just sort of ROI and how do you measure ROI? And whatever you could tell us about those. Is there some minimum number of engagement or amount of engagement, utilization? You talked about how much you work and try to drive engagement and adoption, and how, the last thing you want is someone like a gym membership like me, where I pay for the gym membership but don't use it. What type of engagement do you need to make it make sense for a provider? And any thoughts on measuring ROI? Any thoughts about that?
Sure. No, and I think it's an important question for this audience. So in the employer and payer space, there is no doubt it is not entirely, but very heavily ROI driven, right? The employers and the insurance carriers want to know, whatever I'm investing in the telehealth program, am I at least getting a 2 to 3 to 1 return on that investment? And that is clearly about driving adoption of the program. And even in a provider organization, typically ROI and break even is produced at 2 to 3% engagement, which a lot of those results are specific to Teladoc, not industry-wide as far as adoption numbers. But I will tell you that there are, in addition to that, many provider organizations that we have that have said, look, to me, this is just the way we do business. I need a CAT scan, I need an MRI, I need an outpatient surgery center, and I need a platform and an operational capability to see patients and meet them on their terms, how they want to be met, through mobile, internet, or phone, in their homes while they're away. So it's the cost of doing business. Now, that's not to say that hospitals don't want to see ROI. And often, what I would tell you, at least what we found, is just by even starting with employee populations, there's enough savings to provide value that open up all these other use cases around, care coordination and readmission strategies and retail programs, and a lot of things we've talked about. So 2 to 3% of the employees start using it. They get great ROI. Book of business is higher than that. We just reported in the first quarter, we had 70.5% utilization, which was a significant increase year over year, and that was just for the quarter. And that's our entire book of business. I can show you hospitals that have 5% utilization. I can show you hospitals that have 105% utilization. Driving that often unlocks the value for systems to go ahead and do all the other use cases that we've talked about. So I think it's a great spot to start, but I think there's also other capabilities to look at.
Got it. Thank you very, very much. Let's do this, Dr. Roga. I know we've got to wrap up because it's just about 2 o'clock. I think it's both amazing, the growth in the space, and then just as amazing is the growth of Teladoc and where you guys have come to in terms of the largest in the space and the, if I understood you correctly, and the first publicly traded company in the space, and just an amazing reference list of customers and clients that you work with. So, and I'm very thankful for you spending your time this afternoon, giving people more education around telehealth. It's it's amazing how quickly it's evolved and just watching it grow and how important it's become. So to have someone like you who's been in this really for 8 full plus years now and a former practicing physician and really living it is just so helpful. So thank you so much for sharing your thoughts today in your survey. Just fantastic. Thank you very much.
Well, thank you, Scott, and I'd like to thank all the participants on the line. I'm glad that you could attend with us, and that we'll be sharing our findings as well. I trust everybody found this valuable. I know we didn't get to everyone's question, likely, as we've seen on other webinars, so we will look at responding on those subsequently. And again, thank you all, and we appreciate your feedback if you found this valuable, and appreciate everybody's time today.
Thank you so much, Alan. Just magnificent. Thank you very much.